This situation always gives us the same problems. It's a quick secreting of lymphatic fluid and, in worst case, even bleeding. And when that starts, it's very hard to get the pigments into the skin. If we manage to do even so, the next problem comes up. After the healing phase, too little color is left in the skin. So we recommend the setting on minus, between -1 and -2. It's best also to work with less pressure than usual, but surely as a consequence that means for us we have to go over the same spot again and again. We need more repetitions. But that's possible because thanks to SensiDrive, it senses and it's softer into the skin. Come on. Okay. On normal skin really doesn't require much consideration regarding sensitivity. And where it's a type of skin where we can just go on with the job. Here you see a picture of normal skin with big pores around the nose, but we have like fine pores, no inflammation or other things on the skin. So for normal skin, come on. Hello. For normal skin, so we recommend an adjustment from 0 to +1 to the power setting, and you use the normal pressure. Depending on the technique and on the experience you have, approximately 2 to 4 repetitions per hair stroke are necessary. But on this skin type, usually the finest hair and the perfect color result is nearly always achieved. Now we get into a more difficult skin type, the keratinized hard skin with large pores. Due to its large pores, the skin makes it very difficult for us to get a straight hair stroke or lip line. Once stretched, the hair that we draw is still straight. But once you let it go, however, the color seems to assemble in the pores and the lines appear wiggly. So therefore, we prefer and we recommend to do not a single hair drawing on this type of skin, but a hair shading. So since it's keratinized, it's harder skin, we prefer the power settings, +1 and +2. Don't increase the pressure because SensiDrive takes care of that. And usually 3 to 5 repetitions per hair stroke are necessary. The next skin picture is what we call the lymphatic tissue with intermediate cell substance. This skin type you find on customers of all age. It can be dry, it can be oily, but one thing they all have in common. It's like a spongy tissue with a lot of lymphatic fluid. This also makes it difficult for us to achieve clear lines, especially drawing hair strokes. Although during the treatment and immediately after the treatment, the hairline looks really nice and fine. But it seems like during the healing process, the color seems to swim a little bit, and that makes the hair after the healing look shaded. So we are recommending the neutral setting or the soft setting -1, and draw the lines, the hairlines, slower than usual and only with a soft pressure and with as few repetitions as possible. Okay. One of the most difficult skins is definitely the ones with the scars, or the alopecia totalis or areata. And everyone who has worked on skin with alopecia knows that the pigmentation is associated with several problems. One of them is the skin structure. And it's so different because skin whose follicles have stopped producing hair is substantially harder than normal skin. One would say it's nearly like rubber. It feels while you're working that the needle is almost bouncing off the skin and not penetrating. So this is why you should adjust a power setting of +1 to +2. Stretch the skin very well and use a bit more pressure than usual. Draw the hair strokes slowly, and then 1 to 3 repetitions should be really enough for a satisfying result. Be patient, please. I have it in a second. Here we have a customer with alopecia totalis. And the second difficulty to get the right and natural shape is surely we have to a precise pre-drawing, and the anatomy of the customer's face must be taken into exact consideration, because this can help us to draw the brow in the right position designed by nature. It's very helpful if your customer can bring a photograph along where he or she still had eyebrows. Here we see Mrs. B. She suffers from alopecia totalis since 1998. After 1 year, when there was still no hair growing back, she decided to get her first pigmentation done. Since that time, she got 5 refreshments. So, for Mrs. B experienced 3 different generations of different devices. The shape and position of her eyebrows were found with the help of photos and Mrs. B 13 years ago. In this close-up, the shape can still be seen quite well, and you can still find some individual hair strokes. Oh, yes. Because of those difficulties on alopecia skin, we decided to show you a short demo film with a SensiDrive device of Mrs. B's refreshment of her eyebrows. Hi. Okay. So here we already see Anya filling in the color into the cartridge. And what she does now is she's pre-drawing. That means she's just holding the skin. She's doing it with a device, not with anything else. Important when you do this technique is not to stretch the skin and let the needle just hardly touch, just apply the color onto the skin. That means if the customer would say, I don't like it, she can wipe it off and there's nothing in the skin. So this is still pre-drawing. You can see it because there's so much color, little bumps of color. This is still pre-drawing. I wanted to make it a little bit clearer for you to see also. And that was after the first pass already. As you can see, she's giving a real good stretch to the skin. That means the fingers are really close together. And she's slowly pulling along with a lift off. One thing you couldn't see after the pre-drawing, surely we asked Mrs. B to have a look in the mirror. Because this is what you should always do, is to reassure yourself that the customer agrees with that what you're doing. So before she was doing the hairs very slowly, and now you can see that she's making a bit faster movement in between those hairs. And the hair switch is not strong enough, she goes over it again. Yes. That's the 1 micro she's using. Yes, yes. That's all, yeah. Just the 1 needle, yeah. But you see how close her fingers are together, that she's pulling not only in 2 directions, but also in the 3rd direction downwards with the little finger to get a really, really good stretch on that skin. So here we are already on the other side, pre-drawing. Cut quite a bit. Whoops, that was a little shaker. We're not perfect, we're no machines, you know. So in the meantime, while you're watching, Anya's already preparing our model for you to see while we finish watching the film. So sometimes maybe there's a tip missing here, a tip missing there, and with a 1 micro you can really set it exactly on the hair to make it a bit longer if it was too short. Can we fast forward a bit maybe? Because I'm running out of words here. Okay, we finished. We had a little interview afterwards with Mrs. B, and what she did say that she noticed there was less pain, especially towards the end of the treatment. Sometimes maybe you hear from customers towards the end that skin starts burning, there's a lot of tension in the skin, and Mrs. B said it really got much better. Probably also because the treatment was finished much faster. On the next picture, you see the finished work, a close-up. And you see the different, not only the dark hair, but also the shaded ones in between to give it a more natural look. And next, beautiful. Anyway, she was very happy. She left our institute very satisfied. So, skin. The skin reaction towards the SensiDrive technology, actually we noticed that there was none really to very few irritations. What was clearly apparent for us were the even color results that Leslie was giving us right now. Nodding her head. And on this side, you can't see it right now, but the customer has a little scar in the eyebrow that, bless you, Martina. So Anja already had a talk with the customer, with the model, and to decide, to find out, like Mario said so nicely, what does she want? What does she expect? How does she, what does she want to look like? And she wants it natural, but she wants it wow. So, let's see. We get to that. Kelly, you had a question? Yes?
Is the machine on when we draw it?
Yes, sure.
Machine's on.
Machine's on.
What's the speed
On 100. You go. Well, what you can do, what I like doing also is to reduce the speed, because then the color doesn't flow so much. Yeah, when usually I reduce down to 60 or something. That's not important because you won't have a resistance. When you pre-draw, you're hardly touching the skin. You're actually only applying the color onto the skin.
And when you're using the skin,
we're not picking up because we're filling the color directly into the cartridge, so that it's running like a pen, you know. For pigmentation, no, because well, it depends on how thick the eyebrow is, how thin the eyebrow. On a thin eyebrow, maybe you have to do like one refill. But if you have a thicker eyebrow, a lot of hair to draw, then you probably, well, it depends on how much color you use, how experienced you are with the stretching, how fast you get the color in one stroke. But for one side, I'd say maybe fill it up twice or 3 times. It depends. You know, sometimes you have color, you know it when after shaking it and you fill it a little bit, it's more liquid. Yeah, that means during work also you're losing more color. But when you have the thicker colors, which hardly flow, you know, that they stay longer in the cartridge, you don't have so much color on the skin, just there where you're drawing, and you get along with it much longer. For an eyeliner, for example, I do an eyeliner with 1 filling. Seems to be wiggly.
And the other question for me is the speed I use on my current machines. The speed that I would use to work is 130 to 140.
Oh,
which I've understood to be quite normal with the courses I've been on, yet you seem to work around 100.
Well, with the conventional devices, okay, I think for the body, with these new devices, they are so strong you don't need that speed anymore, because that's mostly when it happens, like this one lady said, cutting the skin is very easy, if the needle's just too fast. But the cartridge device now that we had with the Amir Supreme and also with the SensiDrive, they're so strong. In the face, you don't need that. Maybe on the body, you can do it faster, like when you do areola and things like that. You can speed up if you want to. But in the face, the skin is so delicate mostly, we prefer to work slower because we have the feeling we cause less trauma. Also, the customers tell us when you reduce the speed, it feels less pain. Okay? Another question? Anyone?
I was taught the other way round. I was taught to go faster.
Hey!
So I've been going faster, but it's been taking me longer. I don't, for some reason. I've got a Nuvo intelligence machine, and I have to put it on full whack sometimes to try and get that peak in. So now I go, I'll try it lower, see if that works.
The thing is also you must draw slower. Like when you, when we started this many years ago, in these times, the companies were saying, oh, how fast is your machine going? What, only 130, mine is 150. The next company came and said, we have 180, you know? But the thing is, that doesn't, it's not important. It should be powerful. It should be powerful. The needle, how fast the needle is diving into, it's penetrating into the skin. That's the importance. It's not how often it's done. Yeah? So maybe you just slow down a little bit, try that.
너무 저 느낌으로 강의 한번 하면 좋을 것 같아요.
So it's important to adjust the frequency to your style of working. If you work very quickly, you increase the frequency. If you work slowly, you reduce the frequency. So then in a line there will be the same number of penetrations per square centimeter. Yeah? Because if you stay longer in a certain place, you have to reduce its frequency, otherwise you will cut. Yeah? So, but if you go very fast, then you can go up to the frequency. So it's more a question of your personal style, how you do the line.
Okay.
So this machine, do you use different settings when you do the medical work or on the body?
Well, actually, we've only been using it in the face. In those, I used it only in the face. We didn't use it on the body yet.
But do you think it will need, you'll have more resistance on the body? Do you think it will have to turn it up a bit?